Hey there, I'm Pedro Barata, a GU oncologist out of University Hospital Sideman Cancer Center, Case Western Reserve in Cleveland, Ohio. I'm very happy to be here today chatting a little bit about specific data addressing the CheckMate9-ER trial. Just a quick summary, the 9ER was a pivotal trial evaluating the combination of cabozantinib with nivolumab versus sunitinib for patients who were previously untreated advanced renal cell carcinoma. We've seen data being presented in numerous times with different follow-up. The most recent with for over 5 years of follow-up, and it's very interesting to look at the patients that were enrolled in this study. So the first aspect is the fact that when you're having patients coming to your clinic, you often try to categorize them into risk groups, prognostic risk groups. You can use IMDC as one of the risk group scores you can use. In fact, 9ER included patients with good risk, or favorable risk, intermediate, and poor risk. It's important because it helps you to understand how well are patients destined to do from the prognosis perspective. So those patients were all included in the 9ER trial. What's reassuring from this particular combination of cabozantinib and nivolumab, we do see a superiority, a prolongation of disease control in all these subgroups. You see that when you look at PFS, that's measured PFS in the favorable risk, almost 2 years there for median PFS compared to 12 months or so. In the intermediate risk, around 15 or so months versus 7, as well as intermediate and poor as well. And so from that perspective, irrespective of the risk patients present with, you will see a superiority in regards to controlling the disease. The same when you look at overall survival in the intention to treat population, you know that the treatment with cabozantinib nivolumab achieve a prolonged overall survival. We're really talking, we're really looking into about 4 years or so of median overall survival compared to about 3 years with sunitinib. So it's really important to take into consideration, this categorization of patients. The other aspect that we commonly see in clinical practice is thinking of how patients can present differently. Some will have lung mets, others might have bone mets or liver mets. We all know that the location, the sites of metastasis are independent prognostic factors. We know that patients with liver mets tend to do worse. We know that patients with bone mets tend to do worse. So it's interesting and important to see how does the combination perform in these different groups of patients. And when we look at that data, we can appreciate a superiority of both progression-free survival as well as overall survival compared to sunitinib in all these different subgroups of patients with liver mets or bone mets or lung mets. So in other words, when a patient comes to us and no matter where he has cancer, there's an additional benefit of offering a combination IO-TKI with cabozantinib nivolumab compared to the now old standard of care sunitinib for patients with the different sites of metastasis, which to me is reassuring of the activity of the IO-TKI in patients who come to us and present with metastatic kidney cancer.